Yeah, hello everyone. Hello everyone. This is Dr. Abirami, physical therapist at 360 Spinal Wellness and Rehabilitation. Let's wait for a few more people to join in. Yes. Yeah, we are waiting for the people to join in. Yeah, we'll wait for 2 more minutes. Yep. Okay. So till then, I'll intro like what is it? What are we going to do today? Like what are we going to discuss today? Like today, the topic is like what can go wrong with lumbar spine. I think most commonly known lumbar spine, like low back ache, is a common condition which all of us have heard about. So we briefly see about like what is it. We'll discuss about what is it, what causes it, mainly like what can go wrong with it, like the lower back, what can go wrong with it, and what are the who are the culprits, like what happens like when this happens, and how are we going to fix it. All these are going to be discussed today. So we are waiting for a few more people to join in, and then we can kickstart. Yeah. Yes. Yep. Yes. uh, yes, we'll start. Hello everyone, this is Dr. Abirami, physical therapist at 360 Spinal Wellness and Rehabilitation. Today, our topic is, or the topic we are going to discuss is, what can go wrong with lumbar spine? Yes, what is the spine actually is, and why it is so important? Like, why we have to even talk about that? Yes, this is the spine. Like, okay, it's a central component of our body. The spine is a central component of our body, like even called as a pillar of the body. It connects our upper body to the lower body, and it acts like a pillar. So that's why it is even called as a pillar of the body. And this is normally curved, like this is an S shaped. The upper portion is cervical, and the middle portion is thoracic, and the lower portion is lumbar and sacrum. So today we are going to majorly talk about the lumbar spine region and what are the problems like arises from there. So this lumbar spine is the it's in the lower back leg. Always say like the lower back region is the lumbar spine is situated, and it is five in number: one, L1, L2, L3, L4, and L5. Yes, these lumbar spine is supported by the structures called like ligaments, like the larger muscles, larger ligaments, and the nerves. And the important one is the disc, intervertebral disc. Yeah, all these are the supporting structures around seen around it. And this, like, what is the function of this lumbar spine? What it does, like, it basically protects the spinal cord, one. Then it acts like a shock absorber and the vital function which all of us need. It acts like a shock absorber, and it gives the stability and flexibility. Yes, stability in the sense it keeps us upright, and the flexibility, like flexible movements are happening in this region. So this lumbar vertebra is huge, and it takes most of the body weight is taken by this lumbar region. In this lumbar region, that is the main reason why we get injuries, like prone to more injuries, and that leading to low back pain and low back related problems. So what can go wrong? Like what can go wrong in this? Like yes, from we'll start from the muscles, the structures around the damage around the structures. Like we start from the muscles to the ligaments. Like muscle strain and ligament sprain can happen due to excessive overexertion or overuse of the muscles, which leads to injury to this to muscles and ligaments, causing back pain. Then comes our disc, degenerative disc, which is a common one again. The disc, okay, it goes for wear and tear with age. That leads to low back pain, and it loses its water content. It is almost 80% of water content. The disc is. It loses its water content slowly, getting dehydrated. It loses its shock absorbing functioning effectively. So, second comes our disc bulge. Again, the common word we have all heard about, disc bulge. Yes, disc bulge. I'll keep the mic here. Yeah. Disc bulge is a common one, like when it happens. Yes, when you compress a disc, it comes outwards. That is called compressed disc or bulging disc. This happens due to the overexertion, overpressure to the spine, muscle imbalance. Due to all these reasons, the disc gets compressed. When this compress, it comes outwards and creates pain. And now comes your radiating pain or radiculopathy. This, like when the compressed disc comes and presses or pinches the nerves, the nerve inflammation or injury to the nerve causes pain. That is like the nerve, wherever the nerve is supplied, it causes pain. So that is one of the reason. And coming to the bone, osteoporosis, the bone strength and density, where once it is lost, like or aging it happens, like once it lost, it leads to fracture. So osteoporosis is also dangerous one, like in common causes. And when the spinal foramen, like spinal canal gets narrowed due to this disc prolapse or bulge, the nerves get pressed, or the nerves cannot freely function. Like that time, and again, it causes a low back pain. These are the commonly happening, like from the bone to the ligaments to the disc. These are the common issues happening, and the common things can go wrong in low back pain or lumbar region. Then what causes it? Like yes, these damages are there, these injuries are there. What causes it? Yes, the culprits are bad posture and sitting for a prolonged period, muscle like tightness, and then falls, like overweight, lifting a heavy weight and overweight, and then obesity, lifestyle, like sedentary lifestyle where there's no exercises, like all these, and then even the vitamin D deficiency also causes damage to these structures, thereby causing a low back pain. So these are the low back thing, bad posture. Mainly what happens, why this is caused, like in these what happens is the force is not evenly distributed. It's not evenly distributed, so it puts too much load, or too much load on these muscle, tendon and ligaments beyond their capacity. So they go for a tear, they go for a damage or injury, leading to low back pain. And now comes your treatment part. That is, how are we going to fix it? Yes. How are we going to fix it? Like this treatment should have a assessment, identification of root cause, and treatment for the root cause. Assessment leads to, like, the thorough assessment with history, signs and symptoms, and examinations leads us to a proper identification of the root cause. Root cause is vital to get an effective treatment. To know the if you know the root cause of the problem, we can treat effectively, and the solution also will be effective. So what this treatment carries on. Yes, the treatment carries on. One second. Yeah, yeah. What this treatment is about. Yes, treatment is like the pain. Pain can be treated with the electromodalities, and the root cause treatment should address this. Whatever once the pain is subsided, the root cause has to be addressed. Should be addressed by a protocol, like like a well designed protocol should be followed. That is, rehab protocol should be followed, which should include strengthening, stretching, lifestyle modification, postural correction, and other modalities. Yes, stretching. Going to stretching, like, what happens in stretching. Stretching helps in keeping the muscle to its normal length, because the muscle gets shortened because of the prolonged sitting, like a few activities. So the stretching helps to keep the muscle in the normal length. Yes, no, normal length. Then yes, by giving stretching exercises, this helps to maintain the normal length, thereby the muscle work efficiently, and thereby reduces the pain. Then comes your strengthening exercise. Strengthening exercise is also vital. Like how, what it also it strengthening a muscle will stabilize the spine and gives less load to the spine. Yes, strengthening back muscles and the core muscle is vital. Especially strengthening your core muscle will help you in not only in relieving the symptoms, but also it prevents from reoccurrence. So then comes our manipulation therapy. Manipulation therapy helps in correcting all the problems, and it suggests of like other with all these protocol. One more important thing is like postural correction, lifestyle modification, ergonomic awareness. This is a vital part. Though the treatment protocol takes with this, the effectiveness and the prolonged period of effectiveness is felt only when we follow a correct lifestyle. So, what are the correct lifestyle? It is said to be that, like, we bend so many times, like n number of times in our daily life, like. So for from starting from taking bath, like, brushing our teeth, like that happens, like too much of bending. So from wearing shoes, like everything needs too much of forward bending. Like, that doesn't mean that we cannot follow our normal lifestyle. It's not anybody's mistake. It's a common problem. So, how can we modify? Yes, we should have that awareness about the back. Awareness should be there, like how to take a proper precautions. All these will help you to maintain a normal lifestyle or active lifestyle. So, so that's how the treatment is depend. Here in 360 Spinal Wellness, we follow a program called MDCSR, which includes decompression, correction, strengthening, and mobilization and restoration. This is our integrated program for all the lower back issues or problems, lower back and upper cervical. Yes, any doubts? Like, yes. So the body is curved in such a manner, like it is curved in such a manner so that it can work efficiently, function efficiently. So when this is compromised, the efficiency and function will get failed, so leading to damage and injuries. So it is our almost utmost priority to take care of our body the way it takes care of our care. So that's how it has to be taken care. And this is my topic. Thank you. Yeah, there are a few more questions. Yeah. Yes. Like, what happens with this obesity, like, weight, too much weight puts load on the muscles, like overstretches, like this is how the patient go for, like, or the people go for. So it puts overload on the spine, leading to muscle injury and strain. That puts over pressure on the spine and leading to injuries. And we have this yes, sedentary lifestyle, junk food, bed potato bed, all these causes too much pressure on the back. So yes, lifestyle is a main culprit here. Like, so few modification, not the complete, like few modification and cautious awareness about these will create these damage to our structure is what we needed to address now. It's just an awareness. This will help us to have a proper muscle power and maintain our back in a healthy way. Yeah. Here. Mhm. Yeah, that's how, like, and the one more important point here is, like, we do have a nutrition program that is vital, like, because many of these back pain could be caused because of the nutrition deficiency. So we should take care of this vitamin D, calcium, all these has to be tested and followed, like, has to be maintained well, which will relieve our pain. Yes. Another more tip is, like, yes, for postpartum, like after delivery, post delivery, they carry babies, like incorrect baby. I think that awareness should be given to all the moms. Like, that's how, like, we will be creating regarding that, like, soon. The because if you always search down, like, there's a correct way to feeding, like feeding posture should be maintained. That leads to too much damage to the thing, causing back pain. Basically starts from there, like, causes back pain. Mm. And that's why, like, it is always important, like post delivery rehab is vital for yeah, for the core muscle strengthening, like, bring back to the core and core muscle strength, and lead a active life. Any questions? Yeah, even the bodybuilders, like, usually this is a question given from our clients, like, so see, bodybuilders, like, they engage in too much. It should be a gradual and a gradual protocol, like, too much of weightlifting. Yes, we do get into, like, incorrect position or incorrect program will lead to damage of the disc, leading to major issues or injuries and damage. Mhm. Yeah, yes, yeah, yeah, yes, yes. Software profession again, like IT people who sent in front of a computer for a longer time. These strengthening exercises, flexibility, where the muscle goes into tightness, like sedentary life, like all these, for all the people, like these exercises are vital, like strengthening program and a stretching program is vital. Yeah, I think, yes. Any more questions, please do put it in our chat box, like we will be getting back to you with our replies. Yeah, thank you.